Thank you. This is my second time I'm attending this, this conference, and I'm amazed at the talent, and I'm amazed at the energy that people have to deal with this horrible, horrible issue of asbestos and the diseases. I'd like to go through some of the things we're doing in Ontario and Canada. The building trades represents 150,000 unionized construction workers, 13 unions, and our workers, unfortunately, and their families deal with this horrible issue of asbestos and disease. Canada, unfortunately, has had a horrible history of asbestos. We are probably the world's biggest producer and exporter of asbestos, and that legacy led to creating false science as well. And that was one of the other problems that we had in Canada that tarnishes us as a nation, I believe. Now, you're probably asking, well, why? Asbestos came from one province, Quebec, but to deal with Quebec, and if you took on that industry, it's political suicide if you were a politician. So for years, everybody just got along to get along, essentially what happened. But now, things have changed. But one of the problems we did have is how things changed was, in the 1970s, there was the John Mansville plant in Toronto, which hit the media, and as a result of this John Mansville plant, we ended up having what was called the Dupree Commission in Ontario, and I'll talk about that later on. Now, the general response in Canada was that we put regulation in, but we found out that no matter whatever regulation you put in, it's never good enough. So the issue continued. Now, in Canada, we have 3 federal parties, and 2 of them a couple years ago, the NDP and the Liberals, basically they saw the writing on the wall and they made a policy decision to move away from supporting asbestos. And in their platforms, they actually talked about that if they would get into government, they would, 1, stop funding the asbestos industry. And what I mean by funding it, it isn't only providing money to the lobby group for the asbestos industry in Canada, also the various other tax breaks that were being given federally and provincially to the actual industries. Now, in 2012, the Parti Québécois, a separatist party, took over in Quebec, and they actually made the transition from funding asbestos to looking at getting away from the industry and looking at alternatives. Now, it's interesting enough that the Parti Québécois, for a year, from 1976 on, when it became a party, it was actually a very left-to-center party, but it was still a party that was actually still involved with the asbestos industry. And the asbestos industry in Quebec, it's not as if that it was a major cohort of workers. It was very small, but again, a very powerful force. Now, what do we do for the exposure? Well, we put various pieces of legislation in place. We have the regulation respecting asbestos on construction projects. This deals with constructors and owners, but I can tell you, coming from the building trades, the owners of buildings do not really follow this at all. So essentially what happens is when our workers go in, our workers, it's not as if they're told, well, Carmen, here it is. You have asbestos in this area of the building. Our workers go in, because you got to remember, building trades workers are visitors on a site. What you're doing is the workers show up, you contract it out to a subcontractor, they are exposed, then they leave. So our regulations haven't been actually fallen to the letter of the law. Now, we also have a designated substance regulation. Again, the implementation meant well, but the enforcement hasn't been perfect. We have another regulation on the import, sale, and advertising. Well, I can tell you asbestos products are still coming into Canada and Ontario. So that's something we're working on. There's also a regulation on production. Canada took what is called the controlled use approach. Well, it hasn't worked. There's really no safe level of using asbestos. The Ontario Building Trades believe that we need to get away from the controlled use, and we'll give you, and I'll go through some ideas that we have. Now, here are some numbers I want to go through on Canadians exposed to asbestos by occupation. If you look at the first probably 5 categories, maybe even 6, it's all building trades workers. So residential construction is 43,000. Building is 33. You can see the numbers still being exposed. Now, some numbers on disease, on deaths. From 2007 to 2012, there was a total of 2,268 asbestos-related deaths in Canada. From the same year, from that same period, 1,207 were mesothelioma. Remember, these are approved workers' comp claims. However, when we looked at the number of meso cases that were in the compensation system and the numbers that showed up in the healthcare system, they didn't match up. What was happening was a lot of meso claims, they were just being treated by our healthcare system, and there was no rollover to the compensation system in Ontario. And Ontario has refused to do a public campaign. The compensation board has refused to do a public campaign on, if you have mesothelioma, it's an automatic presumptive disease, meaning all you have to show was you were in a trade or a process that brought you into asbestos, contact with friable asbestos, and it's automatically accepted. So that's been a bit of a shame on Ontario, but we're working on that. Now, some other numbers from the Ontario Occupational Cancer Research Center. And by the way, the OCRC is funded by the Workplace Safety and Insurance Board in Ontario. So our system has the compensation end, and there's a funding end to it as well. So look at some of the numbers on construction workers and their increased risks. So lung cancer, larynx, stomach, and mesothelioma. All of those have an implication with asbestos. So our construction workers have an increased risk of all these type of diseases. Now, our system, up to a few years ago, was fairly positive in compensating asbestos diseases. Lung cancers and mesothelioma are easier, but GI cancers now are getting a little bit more difficult because of some scientific reviews. But again, as we appeal them, we're finding that our tribunal in Ontario, we don't have to go into a court system. We have administrative law tribunal, and we deal it with there, and we're having a little bit more success when we appeal them to the tribunal. Now, what's been the result of 4 decades of campaigns? Well, in 1993, as a result of the Dupree Commission in the late 1970s and 80s, the Dupree Commission was a Chief Justice of Ontario that reviewed the asbestos literature at the time, 5-volume set, and came back and basically said, these diseases should be scheduled and for entitlement. That was the result of lobbying by labor unions, social justice organizations, and believe it or not, some employers as well. Because it was better having them in a collective liability system and compensation, which insulated them from lawsuits. Then we also have a regulation in 2005, asbestos on a construction site. This looks good, but again, like I said, this has been a problem. It hasn't really been enforced that well. We do have something that's very interesting. We have a program at Princess Margaret Hospital, and it looks at mesothelioma, and I believe tomorrow one of the key speakers in the morning will be going through it. Problem with this program at Princess Margaret in Toronto: the workers' compensation system, the Ministry of Health doesn't fund it. It's the building trades unions that are funding it. Very problematic. We're actually in the process of convincing our workplace insurance board in Ontario to start funding this. On average, one mesothelioma case costs them between $400,000 and $50,000 in the beginning. Huge, huge numbers. So if they fund this in the tune of a couple $1 million a year, it's not that much money. Now, in spite of in spite of all the good things we've done, we still have some problems. Well, brake pads are still being imported in Ontario from China, and just west of Toronto, there is a manufacturer that has non-asbestos brake pads. He's competing with Chinese brake pads. Cement pipe is another one that's coming into Ontario. And as one of the speakers earlier today, crayons, we're noticing that as well. Things are changing, however. Starting in 2005, the Globe and Mail, which was never what I would consider a worker-friendly newspaper, started to publish on asbestos. The Toronto Star did the same thing. And even the courts are starting to look at asbestos. And just in February, a contractor was sentenced to jail and fined $45,000. Now, in Canada, we have an amendment to our criminal code, Bill C-45, which not only allows for provincial offenses violation in Ontario, you could also charge an employer criminally for this. The building trades is pushing for private prosecutions in cases where the prosecutors do not choose to go down the road and lay criminal charges. I think that's going to be the next step that we're going to be doing. Now, a strategy. Well, the ban asbestos movement in Canada has taken off. Considering we just had a new government elected in October 2015, Justin Trudeau. His father, Pierre Trudeau, was tied to the asbestos strike in 1949. He was a reporter as a young man. So I have a feeling that by the next year, we're going to have an asbestos ban in Canada. Finally. The other thing we need is a registry of all buildings that contain asbestos in it. That'll probably be part of the ban. We're working on that too. A registry of Canadians exposed to asbestos. I think bits and pieces starting to fall into part about that. An asbestos disease health network, which my good friend tomorrow will be speaking about. Also a fund for asbestos victims that are not compensated as a result of the workplace, the secondary exposure from the wives that are, or the kids that are exposed from the parents bringing it home. Also, we need to be looking at alternatives to asbestos. The global ban, a worldwide ban on asbestos, like I said, and the Canadian ban, which the Liberal government will probably do within the next year, and enshrine an asbestos strategy into law. That last one is important. If you put it into law, it'll be followed, hopefully. But considering that two of the three, well, I think all three political parties now, two for sure, the Conservative Party has probably seen the writing on the wall. They're probably going to jump on board. I have a feeling by the next time I come again next year, I'll be able to report that we're on the road to a ban in Canada. Thank you.